This is a summary of the CPIC dosing guideline for efavirenz and variation in the gene CYP2B6. This guideline was published in April 2019. Due to the increased risk of side effects in CYP2B6 intermediate and poor metabolizers, the guideline recommends a reduced starting dose in these patients. This image is adapted from the PharmGKB efavirenz pharmacokinetic pathway. A link to the original pathway is provided in the description below this video. Efavirenz is a non-nucleoside HIV type 1 reverse transcriptase inhibitor that suppresses HIV-1 replication. It is metabolized in the liver primarily by CYP2B6, although other enzymes are also involved. This metabolism inactivates efavirenz. Efavirenz also increases CYP2B6 expression and enhances its own metabolism in a process known as autoinduction. The magnitude of efavirenz autoinduction is highly variable and can be affected by the presence of different CYP2B6 alleles. In CYP2B6 intermediate or poor metabolizers, the metabolism of efavirenz is decreased. This increases plasma concentrations of efavirenz and puts the patient at an increased risk of developing efavirenz-induced side effects. There are nearly 40 defined alleles of CYP2B6, known as star alleles. A CYP2B6 allele definition table, along with other gene information tables for CYP2B6, can be accessed at the PharmGKB website or by using the link in the description below this video. Further information about CYP2B6 alleles can also be found at the PharmVar website at www.pharmvar.org. A link to PharmVar is also given in the description below this video. Star alleles are characterized by their rate of function relative to the star 1 allele, which is designated as a normal function allele. Diplotypes of CYP2B6 star alleles can be assigned to a metabolizer phenotype as shown in this table and in Table 1 of the guideline. Note that as more evidence becomes available, new star alleles can be added and the functional definition of some star alleles may change. CYP2B6 alleles can exhibit significant substrate-dependent catalytic effects, which should be taken into consideration when assessing allele function. An important caveat for all genotyping tests is that a normal function status is given to all alleles which are not detected in the assay. This can include rare increased function, reduced function, and non-functional alleles which are not routinely screened for in some genotyping tests. In addition, some laboratories only report specific SNPs rather than star alleles for CYP2B6. This can prevent the accurate assignment of a CYP2B6 diplotype to a patient. These are the CPIC dosing recommendations for efavirenz. These recommendations are applicable to adults or pediatric patients weighing more than 40 kilograms. Patients with the CYP2B6 ultra-rapid metabolizer phenotype will have slightly decreased dose-adjusted trough concentrations of efavirenz compared to normal metabolizers. These patients can initiate efavirenz therapy with standard dosing. This is a strong recommendation. Patients with a CYP2B6 rapid metabolizer phenotype will have slightly decreased dose-adjusted trough concentrations of efavirenz compared to normal metabolizers. These patients can initiate efavirenz therapy with standard dosing. This is a strong recommendation. Patients with a CYP2B6 normal metabolizer phenotype will have normal metabolism of efavirenz. These patients can initiate efavirenz therapy with standard dosing. This is a strong recommendation. Patients with the CYP2B6 intermediate metabolizer phenotype will have increased dose-adjusted trough concentrations of efavirenz compared to normal metabolizers and may also be at an increased risk of side effects. A dose reduction should be considered when initiating efavirenz therapy in these patients. This is a moderate recommendation. Patients with the CYP2B6 poor metabolizer phenotype will have increased dose-adjusted trough concentrations of efavirenz compared to normal metabolizers and may also be at a significantly increased risk of side effects and treatment discontinuation. A dose reduction should be considered when initiating efavirenz therapy in these patients. This is a moderate recommendation. The dosing recommendations for efavirenz can be found in Table 2 of the guideline. Detailed footnotes pertaining to the recommendations can be found at the bottom of this table. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where an activity summary can be given for specific combinations of alleles. The activity summary includes implications for the patient's response to efavirenz, the appropriate dosing recommendation for the specific metabolizer phenotype, and the strength of that recommendation. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.